My question to you is, how do you manage the long timelines and the regulatory uncertainty while at the same time keeping your investors informed and committed?
Okay, so I guess that's a question, or that's an experience I learned by the time. I wish I knew that when I started. So I guess that what made the journey at the same time easy and difficult is learning about the challenges and limitations for a medtech or hardware startup. So at first, I started like most of the people from university with zero industrial experience, trying to build prototype and do amazing things that work, but that are not fit with the patient. So you cannot, especially when it comes to healthcare and medtech, you cannot just deliver half products. Okay. So the day I started getting rejected from, let's say, doctors or hospitals or the big institutions, because that day they will be responsible for recommending or prescription of my product. And that day I learned that I should do the regulatory part. And I guess the hassle started from there. So we had to rebuild a huge part of the product. We had to re-choose or reselect a huge part of our suppliers. And we didn't know that that will happen in terms of cost and time. So from the day we decided to do that, it took us around 2 years. So CE mark, we were obliged to do the ISO 13485, and then trying to do the trials and try to do the mandate in Europe and everything, because you have to have someone in Europe. And I guess that that's the valley of death for most of the startups. So I was a bit lucky being a dynamic entrepreneur, so trying to survive with all the odds, trying to navigate the system, trying to secure some funding, trying sometimes even to how to say that, put on hold some products. So we use it like to develop a more advanced version of our product, but where all the fingers are moving, and then we put that on hold to develop a more basic version that will cost us less money so we can go to market before dying. And I guess that's a tricky point, being rational and think like investors. Because if you're too emotional, you'll not make it. And I guess that's applicable on multiple levels. Applicable especially on the level of choosing something to focus on. That's something I want to share with innovators or entrepreneurs. Don't do everything from day one. Try to focus on part of your product. Sometimes just the software layer, maybe. Sometimes just the sensor. Sometimes just a part of the product that has more capability of succeeding and that has more risks of the regulatory layer. So if it's a class 1, not class 2, that's good. If it's class A, not B, that's better. So that's how you navigate, and that's how you select your path as an entrepreneur to reduce the risks and to bring more investors so they can feel safe. And at the parallel side, I also blame investors for not taking part of that risk and taking things, let's say, at a more comfortable and more secure level. Because I guess that a lot of potential is dying in the continent because entrepreneurs cannot make it, not because they're not efficient, but because of the lack of resources and the lack of infrastructure for innovation. So, for example, for our case, when we iterate a different, let's say, innovation or technology phases, it took us more time because we are in Tunisia, not in Europe or in the US. So if we do a PCB design and try to manufacture that, it will take 3-4 months to finish, to bring it and to do the customs. But if you are in a different country, you'll get that in 2-3 weeks. So that delay is what is costing us this, let's say, insecurities. But I guess we have a lot of amazing ideas in the continent. It's saving lives. It looks more like people from the continent to the continent. It's customizable. It's affordable, decentralized. And I guess that by believing more in these startups, not just putting the whole risk or taking the whole risk, but at least knowing where to step in to save these startups from failing. Because I guess that the regulatory part is a very huge and risky thing for innovators. And it was the case for us. We were, as I said, lucky and hard workers to make it. Today we have the CE mark, the ISO, different ones. We are selling in 2 or 3 countries and trying to scale to more countries, working with the government hospital, like military hospital in Tunisia. But it took us years. I'm talking about 4 or 5 years to reach to this stage. And I guess not everyone has the potential or the energy to survive. It's funny sometimes to tell people that we never raised any investment till today. It was a personal choice at a certain level when we knew that without building that by ourselves, taking that to the market, investors will either not be very interested or will give us very small amount of money that will not change anything. So we relied on, I was like, as to say that, some family money, some personal savings, some grants, some cash prizes, and bootstrapping. So we used all the know-how to sell some, let's say, side products. And I guess that, as I said, that's not a model to follow. So we were like lucky to get plus $300,000 in total, or 400,000 in grants and everything, but it impacted our advancement because we didn't receive the whole amount of money in one time, so we can think long term. So I've been taking like 10,000, 20,000, 50, 5,000. So it's always frustrating to plan on the short term. You cannot make senior hiring. You cannot buy like good inventory. You cannot take risks. And that's, I guess, delayed us from going to market in an earlier phase. Also, in terms of technology, as explained, at first we were so emotional. So it was more about being happy and satisfied about what we are building more than what the market is thinking and what the investors will be thinking. And we did that. We reduced all the extra development. We focused in one product. We did the regulatory preparation. And then based on that, we built a lot of other technology using the know-how. So now we have like 6, 7 products. They're all certified. They're all like in the market. And that's another learning, I guess, for people. Another thing, I guess, is collaboration. So sometimes as an entrepreneur, you don't have to build everything yourself. So if there is another company, other startup that is building a component of your product, just take it, make your product functions, and then try to build it in the future yourself. And sometimes it's really useless to build it. If it's in the market already with the right cost, try to build on that or to develop maybe a more software layer or something. So I guess there is a lot of learning from our journey. We've been like working hard, so we didn't give up. We had a lot of moments of weakness where we should have like give up, but yeah, it was tempting to continue the journey. And yeah.
And what's your revenue now, or revenue?
So we are up to $200,000 just in a couple of months by selling products to both hospitals. So B2C, and we're shifting to the B2B to be able to scale bigger. We're even creating a different entity which is called Cure Care, which is a center for fitting people to avoid the B2C headache. So as a B2B company, are focusing more on tech and scalability and leaving the B2C with the right, let's say, medical practitioners and everything. And as I said, this revenue is really organic. So zero investment spent on that, very organic media coverage. We were like lucky, like the Forbes, Reuters and everything. So we're lucky to have this. And yeah, so there.
Okay, thank you. Let's appreciate Mohammed once more. You can hear, this summarizes a journey of what it takes to build medtech in Africa. Small ticket sizes, you don't have enough runway to plan ahead. And I think many innovators in the room resonate with that, right? And here we are, is doing $200,000 in revenue. So that's not a small feat. And it shows that you built it at the right unit economics because you've built without external funding. And I can't wait to see where you'll be 3 years from now. I'm sure investors will be lining up to invest. Even today, like with those numbers, if I had a check, I would be lining up to invest. Yeah.
So today, I guess, as we did most of the job, we are happy to have investors join us. Or in the worst scenario, we can keep working that way. It's gonna be slower, but we learned that during the journey, you should learn to make things yourself. Having investors is good. When you're in an early stage, it's better when you're growing to scale faster, to be competitive in the market. I guess time is very important for startups, but you should learn how to make things yourself. And that will help to bring investors because they will trust you as an entrepreneur that you can make their money or spend their money the right way, not just randomly.
Yeah, thank you. I like that approach. Very frugal, very pragmatic, and you're able to keep the lights on until you hit critical milestones like the FDA approval. Now, I'm going to switch over to the investors. Now, having heard what we've heard from Mohammed, we'd like to hear from both Hiroki and Rowena, what makes medtech too risky for some investors, or for you as an investor? What makes medtech risky, and how do you evaluate startups that are still in the regulatory process? Is there a formula or a method, or how would you evaluate bionics, Cure Bionics, if they came to your process? So, what makes medtech risky, and how would you evaluate a medtech startup like Cure Bionics?
I'll take a stab, and Hiroki can fill in. So, medtech is a very peculiar kind of beast. So the average private capital investor on this continent, they can invest in anything. So we're a private fund. Our investors are expecting returns on their investments. And if you're talking to a sector agnostic fund, which is most private funds on the continent, there's the question of getting the investment into healthcare writ large. And then within the healthcare umbrella, there's the medtech play. The reason that medtech sometimes causes a pause or a question of hesitation is that there are certain aspects of it that are trickier. For example, it's not asset light. Investors love a software that can scale dramatically, that can scale without that much capital investment. And when we're talking about medtech devices, often we're talking about physically having a warehouse, having assets, being able to store it. Also means you need to understand the supply chain, particularly in the current geopolitical context of the tariff wars and what that means for supply chains. It means you need a distribution strategy to actually get out to market. You need a way for people to access your device, which is a question that I think a lot of innovators miss out on as they're bringing their device to market. And there's obviously the question of the regulatory piece. How far can you sell this medtech device? How many countries? What population can it serve? And that's another aspect that gives some pause when you look at a medtech device compared even to another healthcare innovation. What I will say for the founders in this room who are doing such important life-saving work is that hearing these objections, you can come in and you can get ahead of it. You can think about, okay, I know supply chain is a challenge. Where is my manufacturing today? Where is it going to be 5 years from now? I know I'm going to be asked about distribution. How do I get that thought leadership? How do I make sure I can scale to reach multiple markets? And you don't need to have all the answers today. I know many of you are in years 0, 1, 2 of the product that you're building. But even coming to the table, recognizing that is part of your challenge to tackle that, and coming to the table and being hungry to learn from others who have walked before about how your product can get to market, can address one of those challenges. Another aspect of addressing the challenge of medtech is the same thing I would say to any high-risk innovation. In my case, and I'm not the only kind of funder that's out there. I think that's part of why this session is so interesting. There's donors, there's blended finance vehicles. We're a private capital vehicle. And what that means is we are seeking returns on our investment. But because we're a venture capital vehicle, we can make high-risk bets. We can invest in a founder, a first-time founder. We can invest in a geography where other people are afraid to invest. But the only way I can justify a high-risk investment is if there's a high reward on the other side of it. And again, this might not be the right path for all of you. Some of you will intentionally choose a different approach, and that's great. The majority of technology businesses are not venture-backed. The majority of businesses are not venture-backed. But if you're seeking venture backing and you're seeking private capital to come into a high-risk business, you need to show to us when we come into the picture that this, for example, in the case of AI diagnostics, this is a digital stethoscope which could replace all stethoscopes. Here's an intervention. Yes, we're starting in Africa. Yes, we're starting with tuberculosis. But here is a foundational technology that could be deployed not just to every clinic, but beyond the clinics to the community care setting, and help me see the full vision of what is possible with the innovation that you're bringing to market. Help me think bigger. And I would encourage many of you to think bigger than what you might start off in year one.
Thank you.
Thank you. I think Rowena covers pretty much, but maybe I can make a comment on the point about risk versus reward, maybe return for investors. And then maybe in general, people might think more risk than return, and when they consider the medtech, maybe just in general. But also I have a kind of hope that we can generate a kind of start a company can from Africa to expand to other market, could be Asia. So that last week I was in Japan. There's a big conference between Africa and Japan. It's called TICAD. Also, the President Ruto was in Japan, and we invited 8 portfolio company from Africa to Japan, and we organized this kind of session, and we cover those costs. And one of the company is from Morocco, and also which is AI, not medtech, but AI also for echo ultrasound. And then also we visit some of the potential company now Japan, and we had a conversation about they got FDA, the US, and are ready to expand Africa, but also we discussed the possibility to expand to Asia. Because there's a company in Japan, they support a global company to come to Japan and Asian market. Because for some of the companies, it might make sense to go to maybe from Kenya, maybe Uganda, Tanzania, then maybe Indonesia. Also, my friends wanting to start a company also went to Indonesia because of the size of the market. Also, there's some similarity in terms of context. In that case, the market's quite huge and regulation is necessarily to be bad because it can be a barrier to entry once you obtain those kind of licenses. So I think we cannot minimize the risk, but also we can show the kind of potential of the returns, reward for the investors, and then also we can discuss how much also return we can expect also in the future. And also, sorry, it's a bit one more things is, I think there's some medtech or companies can start from Africa because we are in Africa and because we are missing so many like infrastructure engineers. But some company you pitch today, I think such kind of innovation won't happen in Japan because we have quite a number of the clinics, hospital infrastructure, also people. But because we are in Africa, we can create some specific innovation and can duplicate in other countries, also Asia or even in Japan in the rural area. In the near future, also we're gonna face a lack of like facilities. We cannot maintain those kind of things. So that's kind of things also we can discuss. Sorry, that's too long. Thank you.
No, thank you. That's wonderful. And as you're speaking about replicability, it reminds me of that merger that I was talking about earlier today, the South Africa HERX. I don't know whether, Rowena, you are private to the details of that. And
yeah, I'll love to hold that up as an example. So for those of you that aren't aware, in South Africa, there's a company called HERX. And they went to market with a low-cost, smartphone-enabled device in order to better assess people's hearing. And if you heard the story of this company 10 years ago, you would think, oh, this is a nonprofit. They're working in the slums, in the townships. They're screening people for hearing loss. It sounds like a lot of programs that you might hear around the continents. What's really exciting about HERX, they recently announced a $100 million capital injection from Patient Square Capital. They're merging with Lexi Hearing, but the South African team is taking the leadership of that. They're a market leader in the United States and in South Africa and expanding to other markets. And that means they're a market leader in the world. And that innovation was born in Africa.
Yeah.
So if you're looking for success stories to follow, I think it's one
Right.
certainly worth tracking.
Right.
Can I just add also, there are aspects of what they did which is uniquely African in their success. They were the first ones that said, hey, we don't have audiologists. We can't require everyone to go see this specialist that doesn't exist in many of our countries. We're going to bring hearing tests to a smartphone. We're going to make it accessible to the consumer. And then the other thing that the company did, more so than their investors, they tracked the regulatory landscape globally. They knew the regulation was going to change in the United States to allow direct-to-consumer selling. And because they were a small, agile, and smart startup, they were able to take their bets. They made their risk. They invested a lot of their energy and time and capital so that they could be in the store, in Walgreens, on the day the regulation passed. So, and that could have gone either way, but they took that bet because they were young and they were agile, and they won because of that. And I think that's a great story.